So what I'm going to talk about is basically how the hell did I end up doing the residency in public health, and a bit of the struggles that I had when I was a medical student and I started thinking about public health. So I was in my 6th year when I started realizing that I would be choosing public health for good, and that's when I started telling my friends and family that probably, or most probably, that would be the option I would take 1 year after. So this was the face of most of the people that I talked to. So people say, why public health? Why do you choose public health? Be a GP, be a psychiatrist, be something else that you kind of like, but don't go for this option because it's not safe, and you can have something else and then do public health on the side. Just one quick example about what we can do as public health that is not that obvious. For example, in the United States, this is from a campaign, an advocacy campaign made by moms. And in some places in America, it's much easier for children to access guns than to access unhealthy food. So there are very, very good policies to restrict unhealthy food from schools, but very bad policies, and they have very quick access to a gun at home. So this is something that if you become a public health professional and if you interact with legislators, you can do and you can deal with. I like to think that this one is at least my favorite. You think of public health as not just a specific thing, but a combination of several other disciplines. You may choose to do all of them in your work, or you may choose to do just one of them. And this is good if you are, especially you that are engaged in EMSA and in other kinds of activities, if you find yourselves sort of bored with the life in the hospital and you would wish to do different things every day or combine different things in your work, this might be an option. That's why I also think this definition is very motivating itself. Another example, and this is the last one to show that several things can impact your health. This is a very simplified map of the tube in London, and there's a study that shows that if you travel from Westminster until East London or in the East London direction, each stop that you go, the people that live there have 1 year less than of life expectancy. So this is just for you to think that, of course, it's not because they live there, but because the areas have more problems as you go east. There are lots of social problems. There are areas where people don't want to live, and public health is also this, is studying the social determinants and knowing how to act upon them. So my story short, I started in EMSA in 2009, and I think it was about at that time that I realized that there was more than clinical medicine. I didn't realize at that point that I wanted public health at all, so I wanted psychiatry or GP. But as time passed by and I attended more of these meetings and the sessions, I just realized that it's good to be outside the hospital, that I would be extremely bored doing all the same thing every day, doing night shifts after night shifts with the same people. And public health appeared to me with EMSA, and being in sessions and being able to discuss with other colleagues and experts that came to the meetings to discuss specific topics with us, that I realized it could be a good option. I can tell you the exact moment when I fell in love with public health. I think it was probably after I started the training and I started having a bit more of contact with public health, but I can say that probably I would never choose anything else. So if you could ask me, like, as still students, for what kind of people do you think that public health would be a good option, I would say that if you are already here, there's a high probability that you would be a good person for public health, and if you would want to continue having this kind of life in your future careers, going to meetings, meeting other people, working in teams, doing different projects, changing from project to project, from country to country really easily, being able to train abroad more easily than any other specialty, and especially not being locked up in the hospital for the rest of your lives. that might be a good option. Then the question that that you might ask yourselves, or your family and friends and everyone might ask you as well, if it's a safe option. And I just quoted a Brazilian poet that unfortunately is not among us anymore, that the biggest waste in life is that we try to avoid any suffering, and then we also lose happiness. So public health is not easy. In my country, it's not easy in the sense of everyone looks at you like you had no other option because you had a bad mark in your specialty exam, so you have to go into public health. So you will hear a lot of those things if you choose public health, but I think it's worthwhile. You try to prove people and yourself that you can be a really good professional and make the effort. So about to finish, this is, if you had epidemiology, you know the basis, person, place and time. I think this applies as well a lot to practicing public health. It's all about the people you work with, and you work for people and for lots of people, not just for the 10 patients a day you can see in an hospital or in a practice. It's about place, so where you are, where you can work anywhere, you can work remotely. As you don't see patients, you can participate in studies and in projects, you can be an advisor, and also time. So it's something that is very complete. And if you ask me, like, will the way people might view public health in your country ever change and it be like as recognized as being a nice cardiologist or a neurosurgeon or a plastic surgeon, I would say that that is impossible. It's just temporary. Things are changing a lot, and more people are getting interested in public health, and hopefully some of you will also engage into this residency.